So my name's Lennin Caro. I'm the lead community researcher at Camino Research Institute. And today I'm going to be talking about this statewide project we're doing called the Latino Community Strengths and Needs Assessment. And I'm going to present you guys some results that we did from our pilot study in Mecklenburg County. So a little bit about Camino as an organization. We're primarily a health center. We have primary care services that are bilingual. We have behavioral health services. We also have health and education programs, and we also have upward mobility programs, helping people find employment or try to continue their career through exploring education options, things like that. And we've been serving the mostly the Charlotte immigrant community for around 20 years now. And for those that you don't know, we're located in the university area. Here's a picture of kind of aerial view of UNCC and kind of that northeast/eastern Charlotte area, which from what I've been told is the bit more traditional enclave of supposedly where the Latinos live. But from my own research, it looks like we have a lot of different pockets around Mecklenburg County and the Charlotte area of where Latinos are living. So a little bit about kind of the context of why we're doing this study. In the 2020 census, they've shown that for the first time, we've reached over 1 million Latinos living in the state. Now, it's a bit complicated because there are reports out there that kind of verify that Latinos were undercounted in the census, in the censusing of households. But either way, with the official counts, we've hit over 1 million. However, there is this thought that research on Latinos is kind of a bit further behind. So in 2003 and 2006, there have been two studies we want to draw attention towards here. So in 2003, there was kind of a statewide attempt in doing some sort of study, some sort of understanding of the Latinos communities developing around the state, but it wasn't really any direct surveys or quantitative data. It was a series of roundtable meetings with community leaders, which is still really important, right? Because they have on-the-ground experience of, what's going on in their different communities. This was an initiative headed up by the governor's wife at the time, Mary Easley. And they did an analysis of what was available back then with the census data on the Hispanic population, and they compiled a report based on the roundtable discussions and on the analysis of the census data. In 2006, there was an original study conducted by the UNC Charlotte Urban Institute. And this was done in collaboration with Latin American Coalition. What they did is they did their own original survey, and they did phone interviews with, I believe, around 400 different Hispanic individuals living in Mecklenburg County, which is the county that houses the city of Charlotte. They did phone interviews, they did interviews with community leaders. They also did an analysis on census data as well in Mecklenburg County, which is great. It was much needed. However, 2006 was a long time ago, over 15 years ago. And, we kept waiting and waiting to see if they would update it. And eventually it got to the point in which me and my supervisor, Dr. Carrie Revens, we decided, well, why not take a shot in trying to update this data ourselves? So we made a research institute, Camino Research Institute. We were originally the Department of Research and Evaluation, kind of informing the clinic's programs and things like that. But we recognize that there is this dramatic need for original research to inform policies, to inform the development of new programs, and to help people argue for funding and resources when they're writing grants. They need data, and unfortunately, from our experience when I was a grant writer for Camino, it was very limited, the amount of data that we could find to demonstrate the need for economic resources, financial resources, health resources for the Latino immigrant community. So that's why we exist. We exist to help fill the gap in research in Latino communities in North Carolina. So we're a very young institute. We established ourselves like in June 2021, and we did some reports kind of out the gate. We did a COVID study. We had some data from my supervisor's dissertation that we ended up working together to get it published in academic journals. And we also self-published some reports, some quick studies. The latest one we did was on the migrant experience. I interviewed 18 different individuals. I had my intern interview some others to kind of get an understanding on, what are the experiences of migrants are getting here, and what are the difficulties encountered in their travels, and what are their needs once they arrive to North Carolina from the border, or remember they're migrating from. So we do a variety of different ways of giving out data. Today, I'm going to be focusing on the Latino Strengths and Needs report for Mecklenburg County as an example of this ongoing statewide project that we're doing, and hopefully convince you guys to help us out in recruiting participants to take the survey. So the reason why we're doing this health assessment, this needs assessment, because it's not just about health resources, it's to kind of answer this lack of data in the needs of Latinos in different areas of life. Could be health, education, employment, things like that. And in our experience, it's hard to find data on Spanish-speaking immigrant participants, especially folks who disclose that they're undocumented. It's a very vulnerable population, and they're very wary of giving out data to, let's say, and this is admittedly anecdotal in my experience of talking and volunteering in different events and talking to the population we serve, they don't feel very comfortable answering questionnaires from the government or from, formal institutions, like a university, for example. And the survey, and the statewide survey that we're doing, in contrast to the one in 2003, we're trying to hear directly from community members. So we survey them. We want them to tell us what the needs are, not through just community leaders. We wanted an opportunity for them to share their voice through taking their survey. And we want to turn the data we collect through the survey, and if the possibility arises through focus groups, I find that very important. We want to turn it into a comprehensive report that covers the different areas of the social determinants of health, and make it publicly available in English and Spanish so that other people and other nonprofits or other organizations can use it to advocate for policymaking, to support grant writing and provide evidence, and further support advocacy efforts that people might want to undertake by using our data. So to give you a bit of context of how the survey was created, since we're in Mecklenburg County in Charlotte, we decided to let's just try to get Mecklenburg County in order before we try to go statewide. So we took a community participatory based approach in creating this survey, in which the first step we did was create a community advisory board. So we identified different members of the community that we thought were leaders and could refer us to other people that they think it would be very important to represent the community of Mecklenburg County in our advisory board. And we had a lot of people. In our first meeting, I think we had like over 20 different people. And in the first meeting, we kind of sat down and kind of brainstormed what kinds of questions do we want to ask, how should we do it? And then once we nailed down on the types of questions, we then talked about, assisting with getting them to help us to translate it to Spanish, because one of the difficulties we encountered is that there's so many different dialects of Spanish that we wanted to make sure that we're not using phrases and words that only, let's say, a Colombian would understand. Like, my parents are from Colombia, and I realized we have particular vocabulary for certain things. People of Mexican descent might have particular vocabulary to refer to things. Same thing for Argentinians. So we wanted to make sure that it was, in a way, pan-Hispanic, let's say, for lack of a better word. They helped us test the survey out, the experience of it. They helped with data collection, recruiting participants, letting the people they're connected to know, like, hey, there's this survey going on. Don't worry, it's totally anonymous, but it's really important. Trying to convince them and gain their trust into participating in this project. And then further down the line, once we gathered the quantitative data and we did our analysis, we decided to do focus groups. And based on what was coming out in the survey data that we were doing our analysis on, that helped us, along with our CAB, create focus group questions. And they were very involved in trying to pin down the way we should phrase things, word things, things like that. And they also helped us not only recruit participants, but they opened their doors of their facilities for us to come into their area to do focus groups with the people they're connected with, because transportation could be a barrier for people to participate. So in order to make sure we're not only looking at people that come to Camino or live around Camino, but people who live in South Mecklenburg, North Mecklenburg, West Mecklenburg, those areas as well. Here's a screen, a picture of one of our first advisory board meetings with different communities members. So for this pilot study, we had two main methods of data collection. So we had the quantitative portion, in which we had the survey, and then we also had the focus groups. Now with the survey, we kind of made it in a simple link. We called it camino.org/survey. And it was something very simple that people can send through text or WhatsApp, or if people can just type it in their phone, you know, ideally they're able to do that if they couldn't handle the QR code on the flyer. We just try to make it as accessible as we could electronically. This was aimed for adult North Carolina Latinos that currently live in North Carolina. The survey is pretty long, I'm not gonna lie. Actually, we're actively thinking about cutting it a bit more to make it a bit more manageable. But right now it's over 70 questions, and it takes on an average of 15 minutes to complete it. Now, some people take longer, some people take less time, but 15 minutes appears to be the average according to our analytics. And, you know, it's totally anonymous. And the reason why it's totally anonymous is because we do ask them to disclose their documentation status and to assuage IRB requirements and to make sure that everything is okay with protecting their identity. You know, we don't collect any phone numbers, no emails, no nothing in the survey. And we want to make sure that the survey is cell phone friendly. We noticed that a lot of Latinos do have access to technology. Not to say it's not a barrier, it is a barrier, but, you know, for the sake of making sure the surveys are completed and to make sure at the time in 2021, we wanted to comply with COVID-19 compliance from our IRB board. We decided to just go in the electronic route. And the types of questions, I'm going to show you some examples, and when I show you some of the results we found in Mecklenburg County, the questions kind of revolve around the social determinants of health. So we ask about their access to education, access to healthcare, employment, questions related to housing, things like that. And then in Mecklenburg County, we did focus groups. And ideally, as we're taking it statewide, in the different regions in North Carolina, we do want to do focus groups. It's all a question of funding, logistics, and things like that. So, so when it comes to the Mecklenburg County results of our needs assessment, you know, by May 2022, we got 458 responses that we analyzed. And for focus groups, we managed to gather around 36 total participants across 4 different focus groups. And we did an analysis, we did a report, and we released it on September 15th, which is the first day of Hispanic Heritage Month. And we did a whole kind of cultural event at Camino. And we created a video version of summarizing the results of the survey that featured different community members to kind of, you know, say some of the highlights of the results. So, you know, very quickly, I'm going to go through some of the demographics. A lot more women participated in the survey study. This is a trend that we usually see in across our different studies. And most of our participants were immigrants, almost 90%, which is, we thought we would have the opposite problem. But most of the people who took the survey said that they were an immigrant, and 30% of our participants told us that they were undocumented. And we do collect some data on education status that we can do some, you know, further analysis with, but you can kind of see that, you know, significant portion of them report having less than or somewhat of a high school education. But we do have some people who have a bachelor's or graduate degree, things like that. The insurance rate. So we asked in our sample, you know, do you have medical insurance? And 36.7% said they do. So a majority do not have health insurance. But when we look at documentation status, and to give you, to decode the terminology here, by permanent Latinos, we mean citizens or permanent residents. So it's a very crude labeling, but it's something that we conveniently use. So for these permanent Latinos who have more of a, let's say, finite or a more established documentation status, 2/3 of them report having insurance. And you can kind of see it go down to what we call the temporary Latinos, people who have more of a temporary status, like they might have a tourist visa, work visa, or DACA status, something like that. And we see that 1/3 of them have reported having insurance. And then among the undocumented population, only 3.7% reported having medical insurance. In the survey, we asked about the different needs that they have. And here we see that dental is the #1 need for across the board for Mecklenburg County Latinos. And this held true as we controlled for different documentation statuses. But you can kind of see down, these are the top 10. So we have vision, preventative health, doctor that speaks their language, access to cancer screenings, to prescription medicine, English as a second language classes, getting reliable internet, access to loans, help applying for and paying for college. These were the 10 top needs in our 458 sample of Latinos. We do have some more in-depth questions on like their access to dental care and vision care and things like that. You can kind of see here that 73% of our participants don't say that they don't get dental care. And, you know, they usually say that they usually reason it's because they don't have insurance or they can't afford it. And in the focus groups, this came out organically. And 2 participants were having this conversation during the focus groups. Let me read you the quotes here. Almost all the places for vision charge you $150, and that's just for checking your eyes. And we don't know where those affordable services are. I went and said I need glasses for the consultation, the glasses. It was almost $400, $500 every time. It's terrible. I had a problem with my teeth, 1 tooth, and I went to a dentist and the first consultation was free. And to fix my problem, they said, okay, to begin, it's $2,500. But that I can go to Guatemala and get them fixed there. But not everyone has that privilege. It is way too expensive. So again, this stuff was coming out in our conversations in the focus groups as well. We do ask questions about some assets and strengths of the community, just to kind of give us an idea of how do Latinos self-perceive their community and what do they think are the biggest strengths. Interestingly, entrepreneurship was the most selected strength that Latinos picked. And we see some interesting variation because as we did our analysis in Western Carolina, where we have over 500 surveys, work ethic was seen as the #1 strength. So it's going to be very interesting as we do this study statewide to see, you know, how do Latinos perceive themselves, what their strengths of their community is, and how does it vary across the different regions or counties of North Carolina. We also ask a question related to discrimination, in which, interestingly, only 44% said they experienced any discrimination in the place that they're currently living. For those that respond in the positive, we asked 2 follow-up questions on, you know, give us like, what do you think was the top reason for being discriminated against? Most participants picked language. And then when it comes to where they've experienced discrimination, employment, areas of employment was the most selected in the Mecklenburg County sample. And this is really interesting because when I looked at region 2, which is Guilford County, Forsyth County, the Northern Piedmont area, as we called it, I was doing some preliminary analyses on how people respond to this question. And for the undocumented community, that took the survey in region 2, most of them said they never felt discriminated against, or they haven't experienced discrimination where they currently live, which is really interesting because when we look at the citizen sample of that same region 2 sample, when we look at the citizens that took that answered this question, most of them said that they did feel discriminated against in their in where they currently live. And this provokes interesting questions about the phenomenological experience of discrimination. What counts as discrimination in people's minds? How did they define it? And I think that's an interesting research line to follow up in the future if I ever have time to do that. And very quickly, just want to share, like, you know, importance. We ask a question on, you know, how important is it to maintain the Spanish language for your children if they're a child, primary caretaker of a child. And in Mecklenburg County, you can kind of see there's an overwhelming idea that it's very important, that they are very interested in maintaining that their children also are speaking language and maintaining Latino culture. So again, this is something that cultural organizations can use to kind of tell grantors, like, this is what our community wants. Like, we have some evidence about this. I don't have time to go over this quote, but very quickly in the focus group, there was frustrations that came out about navigating the education system. To summarize what's going on here, one participant, well, several participants in different focus groups were saying that they had a hard time navigating the college application process for their children. So I thought that was an important thing to kind of highlight here as well. So on the 15th of September, we
Lennin.
premiered the video and we
Excuse
showed
me.
it, and
Hello?
people like watching it. And if
Lennin.
you want to see a bit bigger analysis here of the report, you have the QR code here. You can also go to our website, camino.org/research. And we're carrying out this study in the different regions. As you can see, we're following the Medicaid managed map that NCDHHS kind of drew out. And, region 1 is probably going to be our first regional report. We have over 500 surveys in that Western Carolina area. We're also gaining momentum in Northern Piedmont region. We're working closely with organizations like Faith Action International House and Hispanic League and helping us get people to take the survey. And we just initiated our region 3, the counties that surround Mecklenburg County. We're trying to get traction there as well. And eventually we're going to get traction. We want to create a community advisory board for region 4, region 5, and region 6 in the future as we kind of close out region 1, 2, and 3. So, and
Lennin,
I'm wrapping up here.
Sorry, I'm getting a report from the interpreter to please slow down.
Oh, sorry.
He's trying to catch up to how fast your Colombian accent or your English started with Colombian brain. So sorry.
Yeah, sorry. I'm sorry. Yeah, let me slow it down here because I know I'm taking up too much time, but
You're doing good with time. Don't worry about that.
So very briefly, I just kind of want to tell everybody here, if you are a Latino, Latina, Latinx, Hispanic, you are eligible to take the survey as long as you live in North Carolina. So please, it's available in English and Spanish. It's Spanish facing. So when you get to the link, you're going to see Spanish first, but there's an option to change it to English. After you take the survey, I encourage you to have other people of your community to take it as well, people that trust you. And it's much different if I'm trying to convince someone to take the survey versus you guys who know your community members that you're connected to take the survey. You can feel free to share the survey on your social media. If you want, maybe I can send an electronic version of the flyer to you guys if you want to post that or share it in your WhatsApp networks. And as we get closer to 2024, we're thinking that we might want to start our community advisory board for region 4, maybe region 5, which is the Raleigh area for region 4. And then region 5, I think, is the Sampson, Duplin, kind of like that farm area of the state. So if you're interested, feel free to email me. My email is just Lennin, LENNIN @camino.org. I can drop it in the chat if you want me to. And that's it. I'm sorry for going fast. I just want to make sure I didn't take up too much time presenting, but I'm open to questions. This is an ongoing study. We're doing preliminary analyses for our CABs in region 1 and region 2. So if you're interested about some insight, what's going on in those areas, feel free to ask. I can give you some limited answers, but thank you guys so much.